Welcome to Inside South Union Township here on the South Union Township Network. Inside South Union Township is brought to you as a joint cooperative venture featuring Township Supervisors Bob Schiff-Bauer, Rick Vernon and Jason Scott, Atlantic Broadband Cable, Armstrong Cable, and our friends at CUTV, including Gary Smith. We're continuing our COVID-19 series here today and being joined by Dr. Deborah Molchan. And Deborah, appreciate you taking the time to join us.
Thank you. Thank you for having me on.
First off, tell us a little about yourself.
I'm a licensed psychologist. I've been licensed since 1995, and I work with adults, children, and families, trying to help them deal with symptoms typically of a lot of anxiety and depression. I have taught at the undergraduate and graduate level, and I'm just excited to be here today to try to deliver some information that might be helpful to people at this time of COVID-19.
And certainly this COVID-19 epidemic and pandemic has really impacted everybody.
Yes, it's a great equalizer. It has definitely impacted everybody. And for those that have anxiety, of course, it'll ramp up symptoms of anxiety or depression. But even for those who have not, it's a time where people may be finding that they're experiencing increased levels of stress from being exposed to all the information.
And I think everybody, no matter what degree and what field you're in, has experienced increased stress at this time.
Absolutely. That would be a very true statement. What is pleasing for me to be able to pass on to the people in the audience is that at this time, most all insurance companies are being very gracious and making it extremely easy for people to seek telehealth services to help them with symptoms of stress. So you can easily call your insurance company on the back of the card and ask for providers that may be having telehealth services. And to inform our audience, telehealth services are those that are both, you can see the person, video, and hear them, audio, and deliver psychotherapy services right in your own home. The nice thing is that most private insurances, or many private insurances, are also at this time covering copays and deductibles, because the emphasis is that you would not want a financial barrier for someone to not seek services at this time.
I think everybody has felt a little economic strain as well during this whole process.
Absolutely. So I'm very, very pleased that that is something that people can be seeking and not have finances be an obstacle.
Talk about the whole progression of this telemedicine. Is it something you've done a lot before this whole pandemic started?
Telemedicine has been around for quite a while, but it hasn't been very much in mainstream. I've used it intermittently for instances where someone is at home, maybe they were recovering from surgery, but quite frankly, very infrequently. So for many people, it has ramped up immediately the need to become very familiar with telehealth. There are some regulations that one must follow, such as telemedicine ideally is delivered on a HIPAA-compliant site. What does that mean? That means that your confidentiality is very important. And people, when they come to your office, can be assured of a certain level of confidentiality. But on the HIPAA-compliant sites, although they're on the internet, they're set up so that you are safe and it can't be hacked easily, and there is an assurance of your security there. So they're delivered on sites like DoxyMe is a familiar one, or Zoom Professional. There's been some relaxing of the standards if that has become difficult, where in some instances even FaceTime and Skype. However, that's not the preference.
And now we're a couple weeks into this whole COVID-19 situation everybody's been trying to process here locally. What have you seen from some of your clients that have already had anxiety disorders? What are you seeing from some maybe new clients as well that are maybe seeing you for the first time because of all that's gone on here over the last couple of weeks?
That's a great question, Brian. I have noticed an increase in anxiety for persons, understandably. And so if someone already has an anxiety diagnosis, it would be understandable that under some conditions it would be increased because of worry for self or worry for someone that they love. Perhaps we can spend just a moment here and I'll explain what some symptoms of anxiety actually are. Anxiety tends to show up a lot in worry thoughts. So our mind tends to ruminate or go over and over thoughts again and again. Part of that is our self-seeking desire to come up with answers, to solve things, to feel better.
And I would think, at least from my experience too, a lot of this is things we can't control and it's hard to process.
Yes. And mind is so stubborn. It has a tendency to go, come on, come up with an answer. You got me, you got the GPS, you got me to where I needed to go, come up with an answer for this. But it tends to go over things again and again of emotions, and sometimes that then makes it more challenging because there's not an easy solution that only comes from that. So ruminating and worry is one symptom of anxiety. Interestingly enough, it's really important for everybody to know this. Other symptoms of anxiety include things like nausea, dizziness, heart palpitations, difficulty concentrating, difficulty sleeping, feeling irritable, feeling very fatigued, and even muscle aches. Now, what did I say that might be in common with something we're all worried about right now, of course? We're worried.
The virus itself,
Yeah. And so, not that we want to ignore symptoms if we're physically ill, but I think what I'd like the audience to know is that first kind of take a calming moment and tell yourself, is this a level of stress that we're all feeling, at this time? What can I do to help calm myself down? And what are the things I can do to assure to not rush to the emergencies, to not overload an already overwhelmed medical system? Take your temperature, take some time and see if those things calm down.
I think so many of these symptoms are kind of intertwined whatsoever. And I mentioned looking at some of the notes that you had here, you see chest pains, you think heart attack, those could be panic attack, it could be indigestion. So you don't know what's going on, for instance.
Right. And so importantly, to help tease that out, we're going to want to pause so that we can learn how to react, respond as opposed to react. And if it seems to be happening for you, please call your insurance company, because there's therapists available, there are psychologists, there are licensed professional counselors, there are marriage and family counselors, and even psychiatrists that can easily be available to you in your own home that can help you make sense of some of those symptoms you may be feeling at this time.
And I would think we're also seeing at this time as well, a lot of folks are maybe a little hesitant to seek medical advice, especially for maybe going to their ER, or going to their family care physician, because of the fact that they might not want to be exposed to somebody else that might have COVID-19 or be around other people as well. And I think you talk about telemedicine, that's another advantage.
That is an advantage. That is one blessing right now, and you're absolutely right. A lot of people are describing anxiety. As a matter of fact, some people have told me, I'm kind of concerned, I'm starting to feel very comfortable at home. I'm concerned when I can finally go outside. I'm fearful, almost agoraphobically. So, but that is a wonderful advantage, and I'm very, very thankful again that it's being made available by our healthcare industry right now.
Let's talk about some of the other symptoms of anxiety right now.
Anxiety tends to show up, as you mentioned, also in chest pains and in nausea. One of the symptoms that show up that we struggle with a lot, that is a big focus in psychotherapy, are our thoughts. Because our thoughts, that's the basis of cognitive behavioral therapy. And a therapist you may contact on telehealth can help all of us with this. One of the symptoms are the rumination of the thoughts, but of the thoughts being not what one would call realistic. For instance, you may notice if you have young children at home, they may say things like, I can't stand this, I can't stand not being with my friends, and I'm frustrated and I'm worried, and this can't go on any longer. And so typically parents may respond with things like, good enough parenting would say, and it's an aspect of cognitive behavioral as well, you realistically go and say, yes, I know this is very disappointing, and I know it's very difficult, and but certainly we can contact your friends on FaceTime, this will eventually end, what we can do in the meantime. All of us need help sometimes in helping our thoughts fall to the more realistic place, instead of resting in the place of discomfort with the awefulisms that tend to happen.
And I think for most of us, too, this is an event that we have not seen in our lifetimes.
No, certainly I have not. No, this is nothing like we have experienced. And so I suppose one of the ways I'm trying to even focus on the advantages of this are that perhaps all of us are going to be called to try to become better at learning how to respond as opposed to react. It's an opportunity for us to really lean into the things we can do to help us better manage.
And it can certainly help, I think, all of us create some learning opportunities down the road as well. Maybe some advancements. You talked about the telemedicine. This might become more common down the road, even after this whole COVID-19 situation ends.
I believe very much, yes, that it will, Brian. I do. Yeah.
We're talking to Dr. Deborah Molchan here on Inside South Union Township, and we'll be back with more right after this.
Davis & Davis, attorneys at law.
Important for people to know that we represent injured people to the best of our ability, and we've been successful doing that. And I don't say that to have people come to see us because we have been successful. I say that because it's true, and it's important.
Another important aspect is the experience that we have is local experience in the court system in Uniontown, in Washington, in Waynesburg.
Davis and Davis, attorneys at law.
We're back here on Inside South Union Township on the South Union Township Network. Brian Morozak alongside Dr. Deborah Molchan, licensed psychologist. And Deborah, certainly an interesting conversation so far. Everybody here being impacted nationwide and internationally by COVID-19. We're certainly seeing the effects here in the area as well. And this is part of a continuing series of programs here on the South Union Township Network, recognizing the seriousness of the COVID-19 virus outbreak. The South Union Township Board of Supervisors developing programming that will be aired on California University Channel 17, working with our medical community and key local officials. We're attempting to keep the public informed with pertinent information on how to respond to the coronavirus crisis. And this is the third in a series of programming focusing on the COVID-19 virus, and will air on CalU Channel 17 and 61. If you have any questions, you can contact South Union Township at southniontwp.com. And Deborah, we were talking earlier, certainly everybody being impacted by this, and I think the coping mechanisms certainly key as far as how to deal with this whole process that everybody's going through right now.
Yes, yeah. It's important that we all have sort of a plan or a template to help us through this, because it'll help the challenges ahead of us feel more manageable. So when we have a roadmap, when we have a GPS, it feels more manageable getting from location A to location B. So to make it through the rest of this, it's important to have a schedule. It's very tempting, just like at Christmas vacation or something, to ignore sleep-wake patterns or go to bed later or stay up earlier or get up earlier. The more that you can adhere to a schedule, the better you're going to function. It helps our body with the circadian rhythm. The more you can do that in a family with your children, that'll also be valuable. To that end, also, it's important that we maintain good nutrition and follow through with the regular things of eating meals together. Eating meals together with a family really promotes oxytocin, which is a feel-good hormone of gratitude and bonding, and that helps our immune system. It helps with stabilization in the family. Interestingly enough, this is not often talked a lot about, but dehydration is important for maintenance of mood. Dehydration contributes to insomnia. It decreases melatonin production, which helps us sleep. And so something you can maintain and focus on is ensuring that you're having enough water and hydrating, and watching how much caffeine intake you have to not interfere with hydration. Also, exercise. Most of us might be like, woohoo, we get to sit at home and the kids are sitting around and the video games and they're playing TV or they're watching TV or playing
That gets
games.
old real fast, though.
Yeah, it does. And the other aspect of that is motion is really good brain potion. And so the interesting thing, this is one of my favorite topics, I'm kind of really stuck on this topic, but one of the best antidepressants and anti-anxiety agents that we can all do is move our body. And that when we get our heart rate up to triple digits, I mean, you want to be cautious and make sure you're healthy, but what it does is it promotes what's known as miracle growth for the brain. It's brain-derived neurotropic factors, and it helps us have a great mood. We can focus better then for about 90 minutes. We have better mood stabilization. So if your kids are sitting at home and they're playing video games and you just can't get them to get up because they're so focused on it, you can have breaks you take on purpose. You can maybe offer for one of them to take turns leading exercises around the house, marching, jumping jacks, yoga postures, whatever it is. Get moving, get your heart rate up, and then sit back down again.
And of course, all the trails and parks here in South Union Township still open, including the Sheepskin Trail, which goes all the way through the township. The one thing I've noticed, and one of the regulars on the trail here on a regular basis, but I've seen more families walking together
Yes.
that I've never seen before, like
Yes.
larger groups of families, still while practicing safe social distancing, but getting some exercise and going in and kind of getting those heart rates up a little bit as a family. And it's something that we typically haven't seen before.
Yes, I've noticed that as well. And when you exercise with family members, there is a level of increased bonding that happens. And by the way, when you're doing it in nature, there are also increased benefits that are very, very healing. So even research that shows that looking at pictures of nature boosts that are very important. So that's, thank you for sharing that. That's helpful.
And there's certainly plenty of space to go out there, as we said, and practice that safe social distancing, and at the same time, get that regular exercise, because you don't want to end up sitting at home for 6 or 8 weeks, depending on how long this is going to drag on, and then you could end up having some other ill health effects
Right.
from keeping yourself so isolated for such a long period of time.
Right. I would have to add that there is an aspect of all of us that perhaps is seeking towards finding our strengths and resiliency, even in the midst of hardship. And many people I have talked to, despite their anxiety being increased or despite challenges with ruminating thoughts, I am hearing a lot of stories about families that are exercising more together and are finding the silver lining, so to speak, of enjoying more family time at dinner and recognizing that the slowing down of life and being able to focus on that is helpful. And so when they are adhering to, sticking to the schedule of eating and doing those kinds of things, they are noticing some benefits of that downtime.
What are some other tips that you have for us?
Well, one of the tips is, of course, that if we get too much in mind, then mind is going to be a huge challenge. Mind of how long is this going to last? And a lot of what I heard today was, I just heard yesterday this is for sure to end of April, and I don't know if I can stand another whole month of this. And so the more we go into mind and go out into the future, we're going to experience a lot more challenges. The body offers, as I said, a lot of benefits for healing. So exercise, getting in nature. But one thing we can do no matter where we're at, and I'm going to hopefully lead all of you through this today, is we can focus on our breath, because our breath, is always with us. And if you have small children in the house, you can help them attend to this by asking them to get a stuffed animal and lay down on the ground and put their stuffed animal on their belly and ask them to breathe in deeply, and their belly will rise, and then the stuffed animal will rise, and as they exhale, it'll fall. And so breathing buddies, taking time during the day where you're engaging in a breathing buddy activity, can help your child calm. And if you do it with them, you're calming. And you're teaching them a lifelong skill of learning how to pause and learning how to stop so that they engage with being with the breath. It also helps us again and again to not get caught up in staying trapped in mind, the constant chatter and rumination of mind. And so if you put your hand, if everybody just puts their hand on their belly out there and you take a deep breath in, you should feel your belly expand about for the count of 5, and as you exhale, it'll fall back towards the spine. And if you engage in that for about, it sounds like a lot, but if you engage in it for 10 minutes a day, the interesting thing is that over 6 weeks, you actually shrink the amygdala, which is a walnut-sized part. Yeah, I mean, it's kind of nerdy, but I love that idea. It's the walnut-sized part of the brain. That's where fight, flight, or freeze resides. And so stress doesn't know the difference between a tiger jumping out at you or the news or coming, hearing about, oh no, I have a sniffle or whatever it is. It all responds the same. So, it's this feeling in your body. And how do we calm that down? We calm that down by going back to the breath. And when we engage in that for about 10 minutes a day after 6 weeks, if you had an fMRI machine measure your brain, your amygdala actually shrinks.
Wow.
Yeah, I know. And so if it was a drug, it would just be all over the news and everybody would be all about it. So those are practical things we can all do at home right now. If we're stuck at home and we're doing these things, we can engage in family, we can engage in exercise, we can engage in again and again the practice of learning how to respond as opposed to react by practicing some of these tools.
It kind of goes back to if you get into a real stressful situation at times, the best thing to do is just calm, get relaxed, think it over, take a couple deep breaths, and then figure out a way, how am I going to respond to this?
Yes, absolutely. And so the more practice we are at it, the quicker that comes up for us,
And if folks are having some issues, what's the best way to get in contact with your office or maybe somebody else around the area during these stressful and difficult times?
You can call the office number at 724-425-0223, but I would also very much encourage you, because there's lots of practitioners all available. You can go on psychologytoday.com, and all you have to do is enter in your zip code, and you're going to have a drop-down of many, many, many different kinds of therapists. And from that, you'll be able to read a bit about their bio, what their intervention style is like, the type of insurances they cover. You'll have their email address, their phone number, and you'll be able to reach out to them and ask them if they have availability right now for telehealth services.
Now, do you have a specialty?
I would say my specialty is focusing on mindfulness techniques.
Okay.
Because of what we know, how that impacts decreasing depression and anxiety. In some studies, mindfulness-based cognitive therapy has been shown to be as effective as antidepressants in relapse of depression. as well as, practicing heart math, diaphragmatic breathing. I find that to be very successful, as well as cognitive behavioral.
And your office is located locally. I know we're doing a lot of telemedicine right now, but if folks want to come and see you after this all passes as well, you're located inside the community.
Yes, I am. Yeah.
Where can folks find you at?
6 Bin Lowman in
Okay.
Uniontown.
So very easy and
Yes.
easy to find and easy to locate here in the area. And also, during this whole process, let's go back to the whole telemedicine. If I'm a patient coming to see you for the first time, what do I need on my end as far as internet access, and how does the whole process work? How do I get connected to you?
On your end, you would just have to have internet connection. And I want to pass some information out that I'd heard recently that people who have school-age children, if they don't have internet access, I had heard that they can contact Verizon to see about getting that currently for a very reduced fee or no fee. So to make things available for persons. But you would simply need to have a device. That can be an iPhone, an iPad, a laptop, any computer device that you would be able to download a DoxyMe or Zoom Professional so that we can chat.
Is this typically face-to-face where I'll see your face, you'll see my
Yes.
face, and we're talking back and forth?
Yeah.
Kind of like a FaceTime
Yeah.
type situation?
Yeah. The other thing that will be necessary, because we still have to honor some of the forms that have to be signed, and so we can send you forms that are electronic that you sign, like an electronic signature for intake, for assessment, and we would need an email address to be able to send those forms to someone.
Are you pretty much doing 100% of your
Yes. For the
practice?
last 2 weeks, I've been doing 100% of the telemedicine. Once the insurance companies, and it looked like that was the position it was moving, that's what I did.
What's the response been so far?
I was quite surprised because, honestly, I was a little bit anxious at first because I've never lived through this, where 100% of people all of a sudden were, doing telemedicine. But the response has been excellent, actually. I would say about 90% of the clients I had were wanting to maintain telemedicine, and others connecting. Sometimes there's challenges, just like anything in life. Like you might have a drop for a moment, but there's ways you can get back on, and we've been able to manage it quite well. For the most part, people are pretty satisfied. You can have good communication, you can have good facial interaction, and it still feels very connected.
We're talking to Dr. Deborah Molchan here at Inside South Union Township. We'll be back to wrap up the program right after this.
Davis and Davis, helping the injured.
If you're injured in an accident, after you address the medical problems, you're going to be faced with numerous questions concerning who's going to pay your medical bills, your property damage, the wages that you might be losing if you can't go to work. These are things that you need counsel for.
That your income is protected, that your bills are paid, that your family's taken care of. We've been doing this since 1976. We've helped injured people. We can help you.
Davis and Davis, attorneys at law.
We're back here in Inside South Union Township on the South Union Township Network. Brian Morozak along with Dr. Deborah Molchan, licensed psychologist, talking about the COVID-19 outbreak in our area. And Dr. Molchan, I think one of the things that everybody's trying to wrap their hands around right now is how long is this whole COVID-19 pandemic going to last in our area? Obviously, we've all been isolated here for 2 or 3 weeks right now, but what are going to be some of the psychological effects down the road if this thing ends up going on for weeks or months, and what are you seeing as far as some of the short-term effects versus what some of the long-term effects might be?
The long-term effects are going to increase, obviously, like anxiety, because again, I mentioned mind. The tendency of mind is we want whatever out of whatever struggle we're in right now. If you can give me a time limit, if you can tell me what it is, then we come up with a plan for it to be tolerable. So the unknown can be very challenging. So I anticipate that anxiety again could increase. So that makes the importance of dealing with having mechanisms for helping us respond again and again and again, to stay more in the present moment. What do we have control over? Because during the break, as you noted, there's so much that we don't have control over. But what do we have control over? We have control over the schedule we create for ourselves. We have control over trying to reach out perhaps to those we love, or reach out for telehealth services. We have control over when we eat. We have control over trying to maintain hydration, and going back again and again to what we can manage in our daily moments.
I think it's important as well for families trying to keep as regular of a schedule as possible and stay in the routine, because as you said too, with the kids not being in school, you still don't want to get out where the kids are staying up till 11 or 12 at night, sleeping in until 10, 11 in the morning, and then you're getting all out of whack for a long period of time.
Absolutely, absolutely. That's like exceedingly important, far more than many of us may realize. You know, when we engage in behavior like that on the short term, over Christmas or short breaks, you know, it seems fun, there's an anticipated end, but interestingly enough, even over those short times, there's still consequences that we're willing to endure at that time. You know, we know that they might be a little crabby when school starts and we get a little out of it, but we tolerate it. I think right now what's very important is to maintain consistency so we can stay steady, stable, and even in the midst of, you know, a challenging time.
For some of the youngsters out there, what are you seeing as far as the adjustment for adapting to more of a homeschool environment what we're seeing right now? And even for folks working, having to work from home, many of us not going into the office like we used to, practicing the safe social distancing. What are some of the challenges that you've seen from some of your clients so far and patients so far?
It's interesting because based on one's temperament, it's affecting different people in some ways differently. For persons that really enjoy a more introverted nature, really, you know, trying to find the silver lining of being at home and trying to adjust to that. However, still also experiencing, feeling at times, social isolation from the little bits that they did enjoy contact. And finding again and again, sharing, what I'm pleased with is sharing with each other, finding ways how we can approach that by getting on FaceTime, by going for walks with people and connecting with them all on FaceTime, by setting up Zoom groups to play games, by creating social media dates, by scheduling with your own family to have times to eat dinner. It's important, you mentioned work. So with work being at home, it's important to still have, okay, I'm going to go upstairs to work, and you have your separate space, but then you come downstairs and say, at lunchtime, this is my free time. I'm going to connect. I'm going to laugh. I'm going to be with you guys.
Yeah.
And then go back up and work, and then come back down. Creating your own separate space and then connected space.
For sure. Certainly very important as well. You've been very insightful during this whole program here in Inside South Union Township. We appreciate your insight. Anything else you'd like to pass along to our viewers here today?
Simply that services are very much available for you, and as I stated, the insurance companies are being very accommodating and making telehealth accessible for persons at this time. So I would encourage anyone who's experiencing a level of anxiety and stress that feels uncomfortable to please reach out to their healthcare providers or get on psychologytoday.com and find someone to assist you through this time.
Yeah, don't let this whole process be any harder than it has to be. There's certainly help out there, and I think we've all seen folks stepping up, and as you mentioned, insurance companies stepping up
Yes.
to doing what they have to do just to make sure that everyone's going to be able to get through this whole process.
Absolutely.
For Dr. Molchan, again, great information. We appreciate you taking the time to join us.
Thank you. Thank you very much.
That's Dr. Deborah Molchan, and that's Inside South Union Township, a joint cooperative venture featuring Township Supervisors Bob Schiffbauer, Rick Vernon, and Jason Scott, Atlantic Broadband Cable, Armstrong Cable, and our friends at CUTV, including Gary Smith. For Dr. Deborah Molchan and Jerry Dupay behind the camera, this is Brian Morozak. Stay safe out there, and have a great day.